So I think when you think about primary care, it's not, the typical things pop in your mind like diabetes, high blood pressure, managing those conditions for the patients. But I think it's more than that, because I think you have to take in the individual as a whole, and it's looking at everything, like what makes the big picture for the patient and how are we basically promoting a healthy lifestyle for those individuals, and encompassing treating chronic health conditions or just promoting a healthy lifestyle for those individuals. So I think it encompasses all of those things.
I define primary care as the ability of a provider to see a patient and treat any of their disease processes, whether it be diabetes, hypertension, or any other, even an acute care if they come in, say they have a cold.
Primary care is taking the whole patient, managing that patient, figuring out the diagnosis of that patient, whether it's refilling medications, coordinating care if we have to do referrals, bringing the patient back to be seen in a 3 to 6 month time frame. That's basically what primary care we get into here.
We see a wide variety of patients. We see them from being small children, I think 6 months age and up to the end of their life, pretty much. So we see a wide range, and they can have several different kinds of problems. It could be something simple like a cold or flu or sore throat to sinus infection. It can be somebody with diabetes or high blood pressure or COPD, or it could be somebody that's been in an accident and has a cut, a laceration, and we suture them up and remove sutures later on when that time comes around. And or it could be that somebody has fallen and gotten hurt and needs to have some x-rays. We've seen them with broken hips and just various kinds of injuries like that, and refer them out to where they need to go when they need that specialized care.
In the setting that we're in, I think a lot of times they're one and the same. I think the primary thing is to try to differentiate whether the patient is lacking primary care. So once you find that out, then you can continue that care with them for a diagnosis you may come up with. A lot of times in the practice setting we're in, people tend to use this as urgent care, but they don't have primary care. So I try to help them in any way I can. So if they come in, for example, like for UTI, but they have elevated blood pressure, I don't feel like it is right to just treat their UTI and not also treat their blood pressure, which is considered more of a primary care type diagnosis.
Primary care in an urgent care environment is very similar to primary care, non-urgent care, except for it's a lot more convenient for patients. Patients are able to not have to worry about making an appointment, so it's more convenient. 7 days a week, that way there's no excuse for them not to be able to follow up.
I think the lines are beginning to blur a little bit because primary care offices are staying open later to meet the urgent needs of the community, and for an urgent care clinic, we want to develop a trusting relationship with our patients so they'll come back for urgent needs and for their primary care needs. And so they're kind of molding and meshing into one, if that's what I can say. The lines are becoming blurred. And that's what's best for the patient to be able to go to one place to have all of their needs met.
Pretty much the basics, with the hypertension, the diabetes, cholesterol management. Those are the big ones. Also getting people discussing their preventative healthcare needs, such as the colonoscopy, the mammograms, DEXA scans, and just talking to people about those things just to kind of complete the overall care for the patient.
Well, with the primary care, we're going to be looking at their labs. Most of the time we'll do a CBC, a CMP, lipids, vitamin D, TSH, those type of things to make sure that their overall health is good. And of course, if there's anything that's off, we'll do their medications and alter those, send off if they need to be referred to endocrinology if they're diabetic, or cardiology if there's other problems with the heart, things of that nature.
primary care can include medication refills. We see patients for high blood pressure. We see type 2 diabetics. We'll see hyperlipidemia.
The type of patients that we see in urgent care that are primary care type patients would be people with high blood pressure, and that can be controlled with medications. We may have to change it, but then truly if it becomes totally uncontrolled and we can't get it down, then we need to refer them out. But for the most part, hypertension is one of the easiest primary care diagnoses to take care of. And then diabetes, because in our area we have so many diabetics, we have to be able to care for those.
But the biggest thing is to not get overwhelmed with the idea that all of this has to be done and their urinary tract infection has to be treated right now. That's not it. You just need to take it piece by piece, manage what's acute, and then figure out how you can help them manage what's chronic. I primarily will see a lot of hypertension, high cholesterol, hypothyroidism, a little bit of anxiety and depression. It just depends on what they need managed and if they're also seeking help from a psychologist. Women's health, COPD and asthma, a little bit of coronary artery disease, but a lot of those patients are under the care of a cardiologist.
I think it comes down to two. One would be the relationship you have with those folks, and then also providing good medical care. You can have a great relationship, but if you provide bad care to them, they're probably not going to come back. If you provide good care, there's a lot of urgent care / family practices that a patient has to choose from. So that's why I like the component relationship and the fact that it shows that you actually care about that individual.
Vital signs, their airway, their breathing, their circulation. That's the primary components. And the patient needs to buy into the treatment plan, because no matter what you offer, if they're not going to do it, it isn't going to be helpful for them to maintain and get well over their problem.
Our particular community here in Horn Lake is an underserved area. We don't have enough primary care providers around here, so when they come to the urgent team, they are very happy to have found a place that can do it all, more like a one-stop shop. We have extended hours that most primary cares do not. We're able to do labs. We're able to do radiology here, so we don't have to send them out. The community likes that.
Wellness physicals are easy to get to at Urgent Team. Again, we take walk-in visits, and a lot of people don't usually get their annual physicals, so this is a perfect place to come and get your annual physicals. A lot of times we find patients who have high blood pressure, right down to problems with lab work. That lets us take care of the whole person, get them on the right medications, and if not, then refer back to their primary care, or pick up that primary as a visit here to manage and follow through with.
One of the most important components of providing primary care in an urgent care setting is to be sure that we provide the follow-up services that those patients need. Their care needs to be managed, and it's kind of like when we're in nursing school and we learn about case management type things, and basically that's what it's like. You have to be able to realize, or you have to know and plan for that these patients need to be having certain lab works done every so often.
With the necessity to provide primary care, that's in essence, when it's not flu season, those are the patients that kind of sustain our practice, essentially, when things kind of drop off after flu season. So I don't think you can come to physician's care just expecting to only do urgent care. It's just not realistic. You're just gonna have to be flexible, and you're gonna have to expect that it's part of the job, and it can be stressful, but yet it can also be very rewarding, because there's a lot of people that I've seen here for 9 years that come back, and I've gotten to know these individuals, and it's really sweet, and it's almost like a little reunion every time I see these people.
I think first and foremost, and I do this with my students, and I'm not going to say I'd be lying if I said I did this every morning, but a lot of the mornings before I start a day of work, I have to ask myself, do I see people as being important? Do I consider them precious? And if that's the case, then I'm going to go into that day treating them like a human being, and that they are important, and no matter what their complaint or what their problem is. If I don't see them like that, then I'm usually going to be short. I'm going to be I'm just not going to care for them the way I should. So I think that's probably the most important thing.